Back in the very late 1970s and early 1980s, psychiatrists began using CT scanning as a way of looking at the brain. And this was the first tool that psychiatrists had that was non-invasive in order to take a look at the shape of the brain. And the early studies showed that the central CSF-filled portion of the brain, the ventricles, were enlarged in people with schizophrenia. Utilizing a group of teenagers who were hospitalized with schizophrenia, we did CT scan studies and determined ventricles were already enlarged at age 15 or 16 years old. And it turns out that people with childhood onset schizophrenia are already having subtle brain changes.
Genetics probably has something to do with mental health problems. Certain kinds of adverse environments probably have to do with certain kinds of mental health problems.
We're talking about too much of a neurotransmitter or too little of a neurotransmitter or a certain part of the brain that's not getting enough of something or too much of something. There's treatment for that. So I think it's extremely freeing to understand this is a brain disorder. There's treatment for this rather than grappling around, did I do something wrong as a parent? Is something wrong environmentally? A mental health disorder is comparable to something like diabetes, epilepsy. Those are the two that come to my mind, where you do get a tremendous benefit from treatment, but it doesn't go away. So you don't fix it and take care of it. You learn to manage it.